Hello and welcome to the Thinking CAAP.
What's up, everybody?
So glad to be back after a short hiatus.
So happy to have you back. I've missed you. I know that you've had some changes in your career since the last time you were our co-host, but I'm happy you're back. We're going to talk about that on a future episode. And we're here today to have a special guest from one of our agencies. Megan, thank you for joining us.
Thank you.
Megan is the executive director for Central Susquehanna Opportunities Council. We're excited to have you and talk about some of your programs.
So, Megan, let's jump into. I actually had the privilege of visiting CSO, one of your offices, and got to see one of your programs. But what would you say is your key program that your agency offers? And if you can give us, a high level overview.
That's a tough question. I think all of our programs are key and they're so closely intertwined. But if I had to choose one, I would choose our case management programs and our self-sufficiency coaching, because that's where we get to really work intensively with families that are working towards self-sufficiency and wrapping around all those other services we offer, like housing support and food, to really support families as they're working towards increasing their self-sufficiency.
Yeah, absolutely. Case management is the conduit for family success. Well, individual and family successes in so many ways.
So can we dig into that just a little bit, though? Because I know that we've used this phrase in a couple previous episodes where we talked with Denise Harlow, our National Community Action Partnership CEO, and with Aaron Lucas from Bucks County Opportunity Council. And I think the self-sufficiency model is a beautiful one within community action to really help folks. So can you talk a little bit about what that looks like and some of that kind of intensive coaching that happens within that program, just to share it with our listeners a little bit more? Because when we hear the term self-sufficiency, I think people have this maybe perception, and maybe that perception is right or wrong, but just want to kind of give a little bit more context for people that maybe aren't familiar with this.
Sure. Case management is just such a powerful process because it really does wrap around family. So when someone contacts CSO, a lot of times they just need help with that utility bill. They just need access to food. They just might need a one-off service, and we're happy to provide that. But we know that families often have multiple needs and multiple goals. And so case management is the process which one of our staff works side by side with the family to address all of their needs, establish goals, and help them move towards gaining additional financial independence. So we have a great example of this. And I think what is really hard for people to understand is it is a process, but it can be an extremely long process. It's not a 6-month process. You're not going to become self-sufficient in a year even. So we have a great story of someone who we've been working with for over 3 years, who just started 6 months ago. She was ready to start volunteering at the CSO offices. So she would come in a few days a week. While she was doing that, we're still supporting her with her housing and budgeting, making sure she has clothing and hygiene products and food, and really working with her just to build her confidence and her independence. And so after volunteering here for a few months, she actually just about a month ago started a new part-time job, independent, outside of CSO. But we're not done with her yet because she still needs our support. We're working with her on managing her household budget. As she has gained income, we're starting to see her having to make decisions between choosing to work or lose benefits. And so really case management is just that one-on-one support for families and whatever they need. And I think oftentimes in community action, case management is really unique because we take a holistic approach that looks at the full scope of the social determinants of health. So if a family has children, if there are spouses or significant others in the family, we're serving that whole household, even if it is just mom that is coming in initially for services. So it's really that holistic support of helping families meet the goals that they think are most important for them as they work towards self-sufficiency.
Yeah, absolutely. Yes. I think the framework of this is really, I think, what is so fantastic about community action, because, and we talk about this in our video, that we talk about who we are. Right? It's, when a family member, when an individual, when a client, however you want to distinguish that person walks through the door, it's not just about that one need, right? There's other underlying challenges. And on a future episode, I know we're going to explore the benefits cliff and talk a little bit more about what that really looks like. Because I think, again, right, this preconceived notion about, if you just get a job, it's simple, right? You're going to pull yourself out of poverty. But we know, and we say this all the time in community action, you can't budget yourself out of poverty, right?
No.
It's far more complex. And so love and appreciate that example very much.
And I think one of the things that is amazing about long-term case management and, as part of this conversation is also those goals and needs change. Just like you said, now that client is earning income and now it's a whole different set of barriers and challenges to overcome. And that's with ever changing in an entire family. So it is an ever growing process. It's not short. It's not quick and sweet. It is extremely rewarding, but it is a journey.
Yeah, absolutely. Well, and we all have evolving circumstances, right? Like, you have an injury, your child is suddenly diagnosed with insert thing here, or, something happens within your family dynamic, or, there's suddenly a storm and you lose your heating system in your house or your electricity goes out, right? Like there's all of these things that could potentially impact. And I think the reality is that not all of us are surrounded by people, resources, or have the resources to try to navigate those challenges. And so that's when, right, insert CSO, Central Susquehanna Opportunities Council, right, steps in to help through that case management support to ensure that people have someone to call and try to work those things out. So if we think a little bit then about, the day-to-day, this idea of case management is not something that is often easily funded. Mm-hmm. And so can you talk to us a little bit about just emerging trends within the funding component of your organization and what's really been important to ensuring that you are securing additional funding to support the organization? Because I think that's an important part of this.
Mm-hmm. Yeah, I mean, that really is the challenge of community action right now, is staying relevant in these changing times, especially in the post-COVID funding era. Again, the thing that sets us apart with that case management sets us apart with funders too, because there are multiple agencies in our counties that offer food assistance or hygiene products. But with our case management having that holistic wraparound, it makes us more marketable from a funding perspective too. We've started to reach out more to our local giving foundations. We work very closely with United Way. We started to partner with some healthcare organizations that have an interest in helping their patients access CSO's comprehensive services, because they understand that patients won't be healthy if they're not living in safe housing or if they don't have access to healthy foods. So we've really been focusing on what makes us unique with that self-sufficiency case management, because it really is what sets us apart from a lot of other local partners.
Oh, absolutely. Appreciate that.
If I can ask one of the other challenges, along the same lines, finding funding is a challenge. One of the other challenges with case management around self-sufficiency is tracking outcomes, right? All the outcomes are variable. Mm-hmm. How is CSO tackling that?
So we set goals for each of our families that we're working with, and then we do track those goals. And so we track, shorter term goals. No, we don't have a family whose goal is to be self-sufficient. That's not the way it works in case management. So right. We look if they're in housing, we look at how long are they able to maintain that housing, or even just obtaining housing as the first goal. And so we track their goals in smaller steps as they work towards self-sufficiency. And once we get the housing worked out, then we might move on to employment. And the first goal might be part-time employment, and then employment at a family sustaining wage, just incrementally helping families increase their circumstances.
Well, and I think from a funding perspective, right, having been a part of nonprofit work for the last 20 plus years, that is an important thing for funders to think about that I just want to lift up, is that there are long-term outcomes of community action. And that is not always so easy for us to point to say, yes, we can absolutely say that within this many months, this is going to happen for this person. And so when we work in this space, that sort of equitable funding opportunity for our agencies to be effective can sometimes be difficult to point to, yes, here's what we can say definitively everyone will achieve. And so for us, we know that across the state of Pennsylvania, 42 agencies officially now that serve every single county, that we've touched collectively over 500,000 people. But what each one of those 500,000 some odd people have needed has varied pretty dramatically from person to person. And the time frame in which our organizations have worked with those individuals could be 6 months, it could be 3 years, it could be 4 years, right? And all different outcomes based on the circumstances and the deep community need.
Absolutely. So let's kind of shift gears a little bit, Megan, and talk a little bit more about the future. So what are some of the emerging trends or issues in the counties that you serve for your agency that you're preparing to address through either new programming, changes in programming, or services?
So right now, housing is the most critical need across all three of our counties. So we do have housing services. We provide short-term rental assistance, homelessness prevention. We have a street outreach program that works directly with families that are experiencing homelessness wherever they're at. But the crisis is huge, and it's well beyond the scope of those emergency services. So CSO has really been active in some work locally to address the housing crisis from all levels. So not just looking at those emergency services, but also looking at development of additional units and just really working with a lot of community partners to address the housing crisis holistically. We know that it's going to take years to achieve the goals we need to, but we have a great group of partners that are working together. So we're staying deeply connected to that group of partners working on housing, looking at how CSO can be a part of that work. We're actively seeking housing grants to expand our services in that area as well.
That's great. We've talked about this quite a bit within our agency and our network and our discussions, but we've heard, a number of folks have said this, that the housing crisis is not going to just be solved by nonprofits and community-based organizations alone. It can't be solved by just healthcare alone. It can't be solved by government alone. It can't be solved by the for-profit, entities alone. It's got to be a multi-layered, collaborative approach within all of those groups in order to really be effective. So we see that trending across the state for sure.
Absolutely. And we know the housing crisis is unique to communities. What works in the counties served by CSO may not work in other parts of Pennsylvania, and we know may not work in other parts of the country.
Yeah, absolutely. So I think we have a couple more questions for you, Megan, and then I think we're going to start to wrap up. We know our listeners like succinct, quick episodes. That's what we're trying to stick to. We're not always the best of it. I can be a little long-winded. Surprise, surprise. But we do want to get to a couple other things that are important. So as you review your community needs assessments, you continue to think about the emerging opportunities from a fundraising perspective and where you really see being effective in solutions within your community. What are some of the things that you see your agency evolving to do or shift to within the next 3 to 5 years? Anything in particular that, as a leader, you're starting to think about and vision out? You have your strategic plan, I know, but is there anything in particular that you really see from a programmatic perspective that you want to lift up?
Yeah, there's a couple of things. That's a great question. So first of all, I think the work I just described around housing and working at that community level is going to be so important for CSO and other community action agencies because we are tasked with providing services at the individual level and serving families directly, but also maintaining those close community connections that are going to be so impactful in continuing to help services evolve and to really develop strategies in local communities that are going to address the needs around families and poverty. So continuing to look at how CSO can be a key player in that and really take the lead in issues like housing and food access and just financial stability in our communities. And then in terms of actually, direct services to customers, we have really been working towards that holistic approach. I see that continuing to evolve, especially as we work more with healthcare providers, really tying our services into health-related needs, looking at how our services affect health outcomes, I think is going to be critical for the future.
Yeah, I agree wholeheartedly. I just did a presentation about health equity and, how much of our zip code impacts our health versus our genetic code. And it's such an important translation, particularly for community action. And we've talked about our work within a very specific framework for a long time. And so I know on a prior episode, I think it was episode 2, Karen Van Zant talked a lot about this and the need for us to continue to think about the framework in which we present our work and the importance of working with healthcare for sure.
So we can give Karen a shout out on her new book.
Yes, absolutely.
Right?
Yes, the publishing just got dropped. So check her out. Find her on LinkedIn. She's a great speaker, does a lot of really amazing work, and is specifically talking about social determinants of health and the impact. So please, yeah, shout out to Karin for sure. We love a good shameless plug here at CAAP. So I am curious, Megan, you've had a long career in community action and specifically at CSO, and we're going to be having a future episode that we're going to be launching, or another episode that we're going to be launching with you and another executive director from STEP, Rochelle Abbott, who will be joining us as well to talk a little bit about some of her agency work and program highlights. But I'm just curious, when you think about CSO and the work that you've done, local impact, really remarkable things that you all have accomplished. What's the thing that keeps you going? Because it's hard work. I mean, I say all the time, I feel very blessed to be able to support you all at the association. I'm thankful to not be doing direct client service work anymore. I appreciate, how hard it is and just what you give up of yourself to continue to do that work. So what keeps you going? What's your secret to just making sure to maintain your sanity and positive attitude?
This one's easy. What keeps me going is the people we serve and the people I serve at CSO, our employees. We're just incredibly blessed at CSO. We have a team of really dedicated staff that is mission aligned, mission driven. They show up every day for our customers and to move our mission forward. But really, when I see the families we served out in the community after the crisis has passed, when they're housed, when the kids are in school, they have transportation, when we're meeting up at soccer games, that's what keeps me going, because that's really changing the future trajectory of that family. And I can see CSO had a tiny part of that. The families that we work with have to work really hard to move forward. And so when you see families that have really been successful in that, that's what keeps us all going.
Yeah, appreciate that very much. Thank you.
I love that. That's like the chef's kiss, Megan.
Yeah.
True. Amanda, I'm sure you have some deep question that you're probably going to ask us to wrap us up here, which is,
my favorite question. Megan, what myths are you busting about community action at CSO?
I think the myth that we're trying to bust is that community action is a silo. We're really working to build partnerships, to build collaboration. There's been, kind of a history of we do food, you can't touch that. And so we're really working to break that down, because we know there's enough families that need food. We could have 5 agencies touching food and we're still not going to meet the need in our communities.
Yeah.
And so we have really, in the last 2 years, seen the power of local agencies working together, breaking down those walls, losing our territorialism, and just working to serve the families. We're doing incredible things in this valley because of that mind shift.
Yeah,
that's
absolutely.
Amazing.
Yeah, love that very much.
Well, thank you so much for taking the time with us today, Megan. We're really excited, and we're excited you actually are going to do this again with us.
Yeah, thank you.
Want to make sure to just give a shout out. If you are interested specifically in learning more about CSO, please visit our website, thecaap.org. You can go to the About Us section, find about our member agencies. Megan, make sure you hold me accountable here. The communities, the counties that you serve in Pennsylvania, Columbia, Montour. Am I forgetting one? Northumberland.
Northumberland, yep.
Thank you. I knew I had it in here. So if you live in those areas, you want to learn more or you just want to learn more about what they do, please visit our website. You can specifically find out about them and learn about their programs and how to take action to help Megan and the team there. So thank you, Megan, for joining us.
And see their beautiful new logos.
Absolutely.
Yeah.
Thank you for the work you do. Thank you for taking time. We know you're incredibly busy. And thank you to all of our listeners for joining us this beautiful day, wherever you are.
Thank you.
Thank you for being a part of this episode of the Thinking CAAP. Check the show notes for resources and links to other episodes. And don't forget to subscribe and follow to be notified when new episodes are released. If you have any community action questions you'd like Beck or one of our local experts to answer in a future episode, please email your questions about community action to info@thecaap.org. Subject line, Thinking CAAP.